This story happened to me quite a few years ago. I was in the United States and I wanted to buy a keyboard for one of my daughters who was learning to play music. Having lived in Israel for many years, I thought a keyboard was called an organ because here it's called an organete. So I walked into the music store where they sell musical instruments and I said to the proprietor, I'd like to buy an organ. He took one look at me and he said, "Yes, sister." Well, I'm a sister, but not that type of sister. So I said to him, no. I'm just a regular person. I'm buying this for my children. And he looked very reverently at me and he said, "We're all your beloved children." Then he asked me, "Sister, where are you from?" And without even thinking, I said, "Jerusalem." So I became the holy sister from the holy city of Jerusalem. And no matter how hard I tried to get out of that box that he had created for me, I couldn't get out of it. I couldn't explain to him who I really was because every time I tried to explain, he just thought I was a very, very humble nun. Finally, my real sister came and we left the store laughing hysterically. But it was really a very frightening experience to me because I realized that he put me in a box. He had a preconceived idea of who I was. And no matter how hard I tried to change that conception of me, he wasn't able to change it because that was already that was already in his brain. He couldn't change what he thought I was, even though the reality is and was so very different. Well, many years later, I wrote an article about this. I'm a writer. I used to be a writer, and I wrote this for one of the magazines about how we put people into boxes. And I wrote, "Let's get out of the habit, pun intended, of seeing nuns where none exist." But the truth of the matter is, this is something that we all do on a certain level. And I think the point of this story is that when we're working with people with Parkinson's, when we're working with a community, we have to look beyond our preconceived notions and see them as people.
Thank you so much, Debbie, for a wonderful and instructive story. Now, I'd like to introduce you to some other members of our committee who will share thoughts on the issue of equity in our field. We'll start with Anissa. Anissa, why does the issue of equity, diversity, and access warrant a dedicated working group?
Health inequalities exist across the globe due to various reasons, including access to appropriate and equitable education, differing values, individual beliefs, and there's so many differences in culture, race, gender, region, socioeconomic differences that impact the health access. But also how diseases like Parkinson's are even diagnosed and treated. It's an extremely broad issue that has so many different layers to consider. It's not just race, but culture. It's not just culture, but region. It's not just region, but it's also socioeconomic resources. It's issue of literacy for some and trust in the healthcare system. There's challenges of bias that not only how we treat people, but even how symptoms are assessed. An example is a Black student who was a medical student who was working on a section over dermatological issues. And he noticed that all the medical textbooks were depicting common skin issues on only white skin, but that many darker skin patients didn't have the same presentation and then wasn't getting appropriate diagnosing of these skin conditions. So he created a graphic for doctors to use depicting the skin conditions in darker skin patients. To date, approaches to addressing these issues have been so unfocused, which is understandable because there's so many variants that exist. The fact that issues of equity and disparity and access to care for people living with Parkinson's persists across the globe is an issue at hand. And inequality is a global pandemic in and of itself. But how do we condense health equity variables in a single approach? How do we combine the issues that impact access to care, such as language, geography, culture, and the trust of the healthcare system? This type of issue warrants an allocation of significant resources and the dedication of many individuals because we're talking about so many different layers of an issue to address. Most research has been focused on white men over 60. We recognize that that is not reaching the larger population or representing all of the faces of Parkinson's. This is a one-size-fits-all mentality that lacks personalization, lack of communication between all systems involved, medical community, our community of care, our social services are all impacted, and that means too many people are being left behind.
Ben, what are some of the challenges related to approaching the issue of equity in our field?
There's no easy way to condense all the variables of health equity into a single approach that will address all the challenges related to this issue. These challenges include reduction in the quality of care, not having access to care, not receiving the same form of care, distrust and fear in the medical system, lack of access to medical care, a disconnect between medical and community services, language barriers and translation, lack of personalized care, and a one-size-fits-all approach. It seems to be difficult to apply our checklist to global health equity due to variations in policies, cultures, and behavior. For example, meetings or conventions can end up being planned at times that are inappropriate for parts of the population. Also, cultural sensitivities, such as the one described by Debbie, may be completely overlooked.
What is our proposed approach? Well, first, we want to develop a checklist that would be applicable and accessible for people with diverse backgrounds, languages, and cultures. Using such a shared tool will help to reverse the bottleneck of care by eliminating distrust, creating greater awareness, and attracting appropriate attention to this socially complex issue. Health equity is a simple concept, but it's hard to achieve. With a properly configured checklist system, we could ensure that no steps in the process are skipped or forgotten. Checklists are easy to use and help us to stay more organized in managing various tasks. Through using a shared tool, a guideline or checklist, we seek to guide the global community to begin reaching out in a commonly defined manner. Without a checklist, it is very easy to overlook important factors. If that occurs, we exclude people from enjoying the benefits of whatever other working groups have to offer. Although a checklist is relevant to all working groups, without a team dedicated to putting it together, it just won't happen. A global checklist could be helpful in identifying specific difficulties and raising global awareness of them. So, if you do something repetitively and want to do it right every time, a checklist is an indispensable tool. Checklists save time because you don't need to use time remembering the steps or processes. Therefore, you can dedicate all your time on doing the task. Checklists also allow you to delegate tasks confidently and effectively. This is an across-the-board issue which needs to be addressed. This should not be the focus of the community, rather it should become an integral part of every aspect of the community. Isabel, what is the potential impact of our project?
Having something widely available that can be adaptable for all communities has the potential of a broader global reach within both in the patient and the medical community. Addressing this issue will positively impact the global Parkinson's community by creating an approach that goes beyond awareness. It will open up some opportunities to empower communities to make a difference and particularly impact the much needed personalization of care of people living with Parkinson's. By sharing our checklist with partners and constituents in other countries, we hope to establish a baseline of data that will be important for analysis, research, costing of service, and more. Our anticipated impact will be behind the scene. We expect to create a tool which enhances the effectiveness of the other working groups. Key audiences and influencers include national and local Parkinson's organizations, primary care, particularly doctors with access to integrated care teams, allied health, social services, faith leaders, non-profit community organizations, and people living with Parkinson's.
Thank you so much, Isabel, and to all the members of this committee for sharing your thoughts with us. We'll conclude with Denise Coley, who will share her own perspectives.
I hope that in the future, all people and communities will be reached and engaged in Parkinson awareness and empowered with hope and quality of life. This is so important for patients and the care partner, and the community and the family. This is based on geographics, is based on socioeconomics, is based on diverse backgrounds. Everyone must have access to resources and education, because education is knowledge and knowledge is empowerment. Reaching more people that are not diagnosed and left behind is a very important goal to me. I also hope that all Parkinson research and clinical trials will have embedded in their framework and process patient engagement that includes all people, all communities, all families, all care partners, by making sure we provide further detail for treatment and medicine. For example, if you think about people and genetic testing, we have uncovered new genes because the pool has gotten enlarged. It started off with 2 genes and it went to 7 to 9 genes, and now there are even more genes that have been uncovered. I feel that if we include all people, all communities, we will have further genes that might point to new treatments, new medical ideas, new way to engage with patients, which is so important. Finally, my dream. My dream encompasses the outreach to all communities, all people, all families. I would like to make sure that they have access to research, to clinical trials, to patient engagement, to resources, and to knowledge, because that will empower the individual to have hope and quality of life, which is so important for Parkinson patients.